Hi there, welcome back. Today we're going to talk about our Allume culture. So I wanted to just sort of frame here that within our culture at Allume, I have personally sort of planted the seed of a secret desire. And, you know, it's not what a typical business owner might wish for, but it is at the heart of what makes me tick. And I hope that I can plant this desire into you, and so that everybody that you contact or reach out to or have any experiences with within the company, as well as patients you serve or anything that you're doing in relation to Allume, I hope that you'll have this same desire, because I think it's really fun and I think it will change your life for the better. So my secret desire is for every employee who works here, everybody who comes and goes, whether they see it in the moment or they see it later on, my desire is for you to have a better life as a result of working here. And you might think, what the heck is she talking about? So what I mean by that is that I want to create an environment where you feel inspired to be your best self, where you discover more and more of what makes you special, where you discover more and more of your authentic gifts, where you learn how to ask for what you need in a way that inspires people to give it to you lovingly, that you grow. And I know that if those things happen, that you will have a better life as a result of working here. Now, that's my intention. I may not be able to cultivate that for every single person, but my truest intention is for that to be the case for you. So I also think about the relationship between employer and employee, between patient and care provider, between a company and the community. I think about those commitments very, very seriously. Expectations. So when you enter into a marriage, for example, you make promises and commitments to each other, and that becomes the baseline for your relationship. So what we do as a team, Allume, is we make a promise to each of our new employees. And then what we invite for you to do is to embody these promises and make these same promises to all the people who come in next. So the promises that we make to you and the promises I make to you personally today and want to foster a relationship with you based on are these promises. First, I vow to create a work environment where you feel cherished, respected, valued, and deeply cared for. Second, I am committed to attracting, nurturing, and engaging and retaining the very best care providers, those who genuinely love caring for others. And the reason that that is so important in terms of the promise I make to you is that my intention is to surround you with excellent people. And you get to be part of a team that is remarkable, that is excellent. So we are not going to go and just hire just to fill spots. Our promise to you is that we look for people who genuinely care for each other, care for others, care for themselves, and bring those people together and to be part of your team. I vow to cultivate a collaborative team invested in helping each other. That is my commitment to you. And much of what you're going to see in this introductory time together is about building those relationships, about collaboration. Last, I promise to provide remarkable care to you. And the way that I will do this is by doing my best to listen again and again to the thoughts, needs, feelings, ideas, wants, preferences of our employee community. And part of what will be required in order for that to work is for you to know what it is you need and want, and to share with me in a way that I can hear you, and to listen yourself to the needs of the community. And so understanding your needs versus the needs of the whole. So my commitment is to listen and to do my best to respond to the full needs of the community, and to invite you to listen to yourself, to be clear about what your wants and needs are, and then have the courage to ask for it in a way that is grounded in your own light. All right, so that's the promise. So, how we began our story is I think people like to hear this. I always get a little bit shy about it, to be totally honest. So I have a stepdaughter, and her name is Amelia. And she and I met through my sweet husband when we were dating, when she was almost 5. So it was just before her 5th birthday. And I remember coming to the door for the first time. We lived in New York City. I lived the Flatiron District, and Frank, my husband, lived on the Upper West Side. We of course were dating at the time. And he opened the door, and there was my sweet husband with Amelia, who is almost 5, and she has cerebral palsy, and she's medically fragile, and she's has her challenges. But picture this little ragamuffin of a girl with this big smile, and he had her wrapped like a monkey around his head, and so she had an arm that was dangling and a little face that was here, and then her legs were here, and he just had her wrapped around him, and this big, beautiful smile. So, this began really my journey with how Allume began. So as Frank and I fell in love, and part of how I fell in love was through her, I faced with him, and they're not my challenges, because it's not been my same loss, I would never say. I observed his challenges and his former wife's challenges in the myriad of complexities that come when you have a child who's medically fragile. And so fast forward to life, married, we came to a point when Amelia, she's 16 now, when she was probably about 11, and her medical complexity had gotten to a point where she really needed to have nursing care at home. And before that, we had always had help, a lot of help. But now she really needed nursing help. And we went and started asking agencies, well, here we are, we have insurance, we can pay for this, and no one would take us. There was no agencies that were willing to take this kind of a complex situation and that number of hours. So 16 hours a day is the number of hours she receives a day. So eventually we were able to get an agency, thank the Lord, to help us out. And but what we learned in the process is that it's not always easy for families to get that support, because there's only about 3 agencies in Connecticut that really serve this population. So we were able to be able to get those services, but other families may not have been able to get them. We were able to hire our own people and plug them into their system, and we've been able to sustain really well. And the nice thing about nursing has been for us that we have a higher level of care at home, which means that Amelia's not in the hospital as much or for as long, because we have much better interventions at home. And so she spends less time in the hospital. She gets fewer infections from being in the hospital less. She has a much, much higher quality of life. She doesn't get sick as fast or as often, because we can usually nip it in the bud at home. And we just have overall, we're able to have a team of people who surround her with care. So this is why we started Allume. It's because we wanted to bring an even higher level of care and support to these particular families. One thing I would like to share too is that in knowing Amelia all these years and in working with other aspects of her life, her school life and her social life, and as well as her medical life, I've met other families, and I've done research, and what I've learned is some things, two pieces of data I always like to share about families who have medically fragile children. The first one is that this kind of a situation is very hard on marriages. And the numbers are astounding. 80% of families, couples who have a severely disabled child end up in divorce. Okay, so that's horrible, right? Second, much higher than the regular divorce rates. The second thing is that, and this is the one that also is really hard to swallow, is that families who have medically fragile children also encounter bankruptcy at a much higher level. 60% of the families who have a medically fragile child will file for bankruptcy, not just once, but twice. Okay? So what this amounts to in a lot of situations is, single parents, often mothers, who are caring for their children, doing their best that they can. They can't always go to work because nobody's there when the child gets sick. Or they have nursing care that is not consistent, and people call out, and then they have to not go into work, and then they have to call out from their job, and they get fired eventually, or they just give up. So it compounds into their other areas of their life, their social life, their emotional life, their financial life, their health gets a toll. So, being able to go in and help families just to provide, the service that we provide is so important, because if we can be there and show up on time, be consistent, we can't solve every problem that they might encounter. We can't prevent them from, divorcing. We can't prevent them from having financial challenges. We can't make their children's social lives easier or their medical lives easier in terms of, a child who's in a wheelchair being able to one day walk. We can't do that. But what we can do is we can be there, okay, like a rock. We can be there to support the families when they need us. We show up, we give the services, and that gives the families the ability to have a normal life and be able to sort of start to correct for the other areas of their life that have gone out of whack as a result of this challenge. So I encourage you to have a story, to know why it is that you're in home health, why it is you are a care provider, why you chose to be a nurse or a home health aide or whatever it is that you're doing. What is your story? So I would like you to send me an email right now. So admin@allumecares.com. Send me an email and tell me your story. What is your story? Why did you decide to become a care provider? So admin@allumecares.com, and in the subject write my story. So it's going to be your story, not my story, your story. And in the body of the email, tell me what your story is, any part of it. Why did you decide to become a care provider? Okay? Thanks. Go make the world a better place. Thanks.